You may have been told that you or a family member has diabetes. It is a disease that has many complications, but yet can also be well managed with your food choices, daily exercise, and medications. In the next few minutes, you will learn how to manage your diabetes to prevent complications from arising. You can always ask your doctor any questions that you have about diabetes.
What is diabetes?
Diabetes is when your blood glucose or blood sugar is too high. Your blood will always have some sugar in it, but it can be hazardous for your health if it gets too high. Glucose mostly comes from the food you eat, but is also produced by your liver and muscles. Blood carries the glucose to your cells in your body. Insulin is the key to allow glucose to get into your cells. If your body doesn't make enough insulin, the glucose can't get into your cells. It then stays in your blood instead of being stored away and used for energy. Types of diabetes. You can get diabetes at any age. There are two main types. Type 1, called juvenile diabetes or insulin dependent, and type 2, also called adult onset diabetes or non-insulin dependent. Type 1 diabetes is usually diagnosed in children, teenagers, or young adults. This type of diabetes is caused by the beta cells of the pancreas not being able to produce enough insulin. Treatment for type 1 diabetes includes taking insulin, making wise food choices, and being physically active. Type 2 diabetes is the most common form of diabetes. It can develop at any age, even childhood. This type of diabetes usually begins with insulin resistance, in which the liver and muscle cells cannot use the insulin properly. With time, the pancreas may not be able to keep up to secrete enough insulin in response to meals. Being overweight increases your chances of having type 2 diabetes. Treatment includes using diabetic medications, making wise food choices, and being physically active, and for some, also controlling blood pressure and cholesterol. How do you know if you have diabetes? Your doctor will be able to tell you if you have diabetes by ordering a fasting blood glucose test. The normal range for blood glucose is between 80 and 120. If your blood sugar is higher than 120 for 2 or more tests, you have the diagnosis of pre-diabetes or diabetes. You may have also noticed other signs of diabetes, including having blurry eyesight, being very thirsty, feeling very tired or hungry, losing weight without trying, urinating often, having sores that heal slowly, having dry, itchy skin, losing the feeling in your feet, or having tingling in your feet. You may have had one or more of these signs before you were diagnosed with diabetes.
Complications of diabetes. Diabetes affects every vessel and nerve in your body, from your head to your toes, and can lead to serious problems if your blood sugar is too high for too long. A few complications include decreased eyesight, kidney disease, numbness of the feet, difficulty healing wounds, and possibly amputation. The most serious problem caused by diabetes is heart disease. With diabetes, you are twice as likely to have a heart attack or stroke, but also have the same risk for a heart attack as those who already had a heart attack. These complications can be reduced with close control of your blood sugar, your blood pressure, and cholesterol. If you smoke, talk to your doctor about quitting. Your team of caregivers. You are not alone in managing your diabetes. A team of medical specialists and support from friends and family can help you prevent diabetes-related complications from occurring. Here's the team. Primary care physician or internist. This doctor plays the most critical role of coordinator of your diabetes medical care. They are often the first to diagnose the disease. They will also send you to other specialists for care. Your primary care doctor will prescribe and manage your diabetes medications and insulin. This doctor will also watch your kidney function in order to prevent kidney disease due to diabetes. Eye doctor. The tiny blood vessels in the eyes may restrict blood flow due to diabetes, just as blood flow may be restricted throughout the body. Diabetic eye disease can be prevented if managed properly. Podiatrist. Podiatrists specialize in foot and ankle care. Diabetes can affect the feet by altering the nerve function and restricting blood flow. Due to these problems, other complications can develop and may result in amputation if untreated. Have your feet checked by a podiatrist at least once per year for symptoms such as loss of sensation, burning, or tingling. Pharmacist. Successful management of diabetes sometimes requires medication. Talk to your pharmacist to make sure you understand how to take your medications and risks of taking any over-the-counter medications. Family and friends. Your family and friends can help you with your diabetes. Things they can do is remind you to take your medications and check your blood sugar. They can also help you prepare healthy meals that follow a diet plan. Exercising is always more fun with someone, so take a walk or develop an exercise plan with someone to motivate each other. You are the most important team member. By using what you have learned about the disease, you can better manage your blood sugar, blood cholesterol, and blood pressure to easily prevent complications. How to prevent diabetes-related complications. Diabetes is a life-changing disease. You may have to change your diet to better control your blood sugars, cholesterol, and blood pressure. If these factors are not well controlled, you may experience complications like kidney disease, eye disease, ulcerations, or amputations. Thankfully, you and your diabetes support team can slow the progression of such complications. Here's what you can do. First, and most importantly, check your blood sugar regularly and aim for it to be within the normal range. The normal range is 80 to 120. Keeping a normal blood sugar level shows the glucose is getting inside the cells to be used as energy. It will prevent damage to your nerves and tiny blood vessels that could lead to blindness, kidney disease, and foot amputation. Secondly, see your doctors regularly for diabetes maintenance and prevention. This includes your primary care or diabetes doctor to manage your medications. Keep your appointments with your eye doctor and foot doctor to evaluate for any possible complications. Taking care of your diabetes every day. Follow your meal plan. Develop a meal plan to determine what to eat and when. Include foods that are good for you and that you and your family like to eat. Your meal plan should include breads, rice, and grains,
fruits and vegetables, meat and meat substitutes, dairy products, and some fats. Wise food choices will help you reach and maintain a healthy weight and keep your blood glucose, blood pressure, and cholesterol under control. It will also help prevent heart and blood vessel disease. Don't skip meals, especially after taking insulin. Your blood sugar will go too low. Strive to eat several small meals a day instead of 1 or 2 big meals. Be physically active. Be physically active every day to stay healthy. Try walking, swimming, dancing, or riding a bike. You even exercise when you clean your house or work in the yard. Exercise helps you and your diabetes in many ways. It helps keep your weight down, helps insulin to lower blood glucose, good for your heart and lungs, and gives you more energy. Before beginning an exercise program, talk to your doctor to check your heart and feet for any special problems and help you find safe exercise. Try to work up to exercising 30 minutes per day. You may have to start with 10 minutes 3 times a day. Check your blood sugar before and after you exercise. Eat a small snack if your blood sugar is below 100.
Take your diabetic medications every day. Be sure to take your diabetic medications every day. Diabetic pills help to lower your blood glucose when your body doesn't make enough insulin or none at all. You may still need to take insulin with the pills for a while. Losing 10 to 15 pounds can help you reach your target blood glucose levels. Check with your doctor before stopping your medication. Insulin is needed if your body doesn't make enough or has stopped producing insulin. Everyone with type 1 diabetes needs insulin, and many people with type 2 diabetes need it too. Your doctor will tell you which insulin is best for you and how to take it. Diabetes can also be well managed without medication through regular exercise and meal plans. Check your blood glucose as recommended. Check your blood glucose as recommended by your doctor. Some will check their glucose once per day, others will check it 3 to 4 times per day. This will allow you to track how well you are taking care of your diabetes. If your blood sugar is too high or low, you may need to adjust your meal plan, exercises, or medications. Your doctors will check your blood sugar with a lab test called the hemoglobin A1C. The hemoglobin A1C test shows your average blood sugar over the past 2 to 3 months. A result below 7 shows your diabetic treatment is working well and under control. If your test result is 8 or above, your blood sugar is too high, putting you at risk for the diabetes complications such as kidney disease. You will need to change your meal plan, physical activity plan, or your diabetic medications. Talk to your doctor about what your target should be and how you can achieve it. Keep daily records. Keeping a log of your blood glucose checks will allow you to track how well you are taking care of your diabetes. Your doctors will be interested in seeing your progress as well and can use these records to make changes as needed. You may consider also writing down what you ate, how you felt, and if you exercised when you checked your blood sugar. These are the things you want to record in your record book. Results from your blood glucose checks, your diabetes medications, times and amounts taken, if your blood glucose was low, if you ate more food than you usually do, if you were sick, and the type of physical activity you did, and for how long. Why is taking care of your diabetes important? Diabetes and your heart and blood vessels. Diabetes can lead to heart and blood vessel disease. It can increase your chance in heart attacks and strokes. It can also cause poor blood flow or poor circulation to the feet and legs. At least once per year, have your doctor check your cholesterol. Limit the amount of fatty foods you eat, such as bacon, fried foods, butter, cream, lard, and other high-fat dairy products. If needed, take medicine to control your blood fat levels. At every healthcare visit, you should have your blood pressure taken and recorded in your diabetes log. The target for most people is below 130/80. If your blood pressure is high, discuss with your doctor ways to lower it through diet, exercise, or medication. Diabetes and your eyes. Have your eyes checked once per year. You could have problems with your eyes that you have not noticed yet. Yearly exams can catch problems early to prevent blindness. High blood sugar can make the tiny vessels in the eye bleed. You can prevent damage by keeping your blood sugar as close to normal as possible. Tell your doctor if you have blurry vision, seeing spots, or flashing lights. Diabetes and your kidneys. Kidneys help clean waste products from your blood. They also keep the right balance of sodium and fluid in your body. Too much glucose in your blood is hard on your body. After several years of high blood sugar, the kidneys can stop working, also called kidney failure. If your kidneys stop working, you will need dialysis. Diabetes and your feet. Diabetes can greatly affect your feet. Over time, you may lose feeling of your feet. When this happens, you may not be able to feel a rock in your shoe or a blister on your foot that could lead to cuts and sores. Diabetes can decrease the amount of blood flow to your feet, leading to a harder time healing foot wounds and possibly amputation. Foot care is very important for all people with diabetes. Here are 3 things you can do to protect your feet and lower the risk of losing a toe, foot, or a leg. 1. Wear shoes at all times, such as a sneaker or an athletic shoe. Do not walk barefoot inside or outside. You may not be able to feel the pain if you step on something sharp. Make sure your shoe fits properly, not too tight and not too big. And check inside your shoes daily to make sure that the lining is smooth and no objects are present. 2. Check your feet every day. Make this a part of your daily routine, such as after washing your feet or after taking off your shoes at the end of the day. Use a mirror to help see the bottoms of your feet. Check your feet after exercise for blisters or sores that may have developed. 3. The most important thing that you can do to protect your feet is keep your blood sugar within normal limits. This will protect your feet from further loss of sensation. Ask your doctor to check your feet at every visit.